Dr. Badani, what is the difference between genomic and genetic testing?
It's a great question. So genetic testing is testing for a specific gene, right? A gene is something that comes out of your DNA. So a good example of a genetic test is BRCA, right? The BRCA mutation that women get prophylactic breast surgery or ovarian surgery because they're at risk for developing cancer. That's a gene. And if you have that gene, you're at higher risk. Genomic testing is actually looking at a whole bunch of genes and how they interact together. And so the complexity of genetics in a human being is profound. But genes don't work in a vacuum. They work together. They work in different ways. And so some genes that work together can show that it can be a good behavior. Other genes that work together show bad behavior. So genetic is really looking at a gene or two. Genomics is kind of looking at a family of genes that work together.
When would a man have a genomic test, and when would a man have a genetic test?
Right.
For prostate cancer.
This is all being worked out. I mean, this is sort of the hard and fast science that's happening right now for prostate cancer. BRCA, same as the breast cancer gene, actually has been shown to predispose men to prostate cancer. So men are being genetically tested for BRCA mutations because that is a risk factor. But the majority of testing that's done is genomic testing. So a man who's been diagnosed with prostate cancer can take a piece of their tumor from the biopsy, the actual tumor's tissue, and do a genomic test to look at the profile of genes and how they behave.
Okay, so once a man has a genomic test done, is that something that a man would ask the doctor to have that test, or does the doctor usually recommend that?
Great question. I mean, this is new to the prostate cancer world, and so genomic testing has been around for breast cancer, lung, and colon cancer for a long time. So most doctors who treat those cancers automatically do those tests. Genomic testing for prostate cancer is relatively new, and so it hasn't permeated the field as much as the other cancers. So some doctors who are in tune with that will offer it and say, hey, we have genomic testing, we should do that. But some patients actually hear about it or have family members that have had breast, colon, lung cancer that know about it and ask for it. But as this matures, it'll become a standard part of how we deal with prostate cancer.
And that genomic testing, again, is just so that way a man can feel more confident whether he should pursue active surveillance or more aggressive treatment.
Yeah, I mean, the kicker in all of this is this an indolent, quiet, non-aggressive cancer or not? And these are the tools to help us figure that out.